So Fine Gael over the last few weeks have been trying to bully the nurses. Not a very smart move if you want to stay on top of the polls. Everybody knows that the nurses do an amazing job in the worst of conditions. But no, Leo Varadkar has been on the media condemning the timing of the strike. Fine Gael TD Noel Rock has been all over the radio and in the newspapers saying the last thing the health service needs is a nurses strike, as if they're somehow responsible for the state that our health service is in. And even Pascal Donoghue has been threatening the nurses that they won't get the increments they're due if they strike. You see, Fine Gael are nervous. They're nervous about a nurses strike because they know most people support the nurses. And then that idiot Paul Bell, a Labour Party member and leading member of SIP2, then says he's instructing SIP2 members to cross the nurses' pickets. But thankfully most working class people and most members of SIP2 are smarter than the Labour Party, because we fully support the nurses and we fully support their strike. There's 1,754 less staff nurses now than there was in 2008. And despite that massive fall in the numbers of staff nurses, the amount of work they have to do has increased massively in the last 10 years. And the TVs have some cheek condemning the nurses for asking for a legitimate pay rise. The average price of a house in Dublin right now is $350,000. It would take 3 nurses to get a mortgage on that house. But then again, if you're a TD, you're fine, because Leo Varadkar's on over 100 grand a year and people like Noel Rock are on over 90 grand a year, not to mention all the expenses that they apply for. Our health service is in ruins, and it's got nothing to do with the pay demands of nurses and everything to do with government policy. Fianna Fáil, the Green Party, Fine Gael and Labour have all been complicit in the ruining of our health service. You can name the health ministers: Mary Harney, James Riley and even Simon Harris. They've all adopted identical policies, and those policies all stem from a political philosophy: neoliberalism. What does that mean? It means privatisation and outsourcing. It means running down public services and selling them off to the highest bidder. In 2008, the author Naomi Klein, author of the book The Shock Doctrine, explained how they'd used the banking crisis to get their hands on our public services and sell them off. She said, the massive debts the public is accumulating to bail out the speculators will then become part of a global budget crisis that will become the rationalisation for deep cuts into social programmes and for a renewed push to privatise what is left of the public sector. We can see this privatisation model at work in the USA. The USA spends twice as much on health as the EU countries, and yet they get nothing for it. Where's all the money going? All the money is going into the pockets of private companies who make massive profits off the US health service. So there you go, that's the model, the neoliberal model of health that Fianna Fáil and Fine Gael, that the landlord parties want for this country. Haven't got private health insurance? Stay on the side of the road, the ambulance will pass you by. I mean, Ireland had loads of small hospitals, places like Monaghan, Loughlinstown Hospital, Ennis. The government closed those down because they said they were too small. But hang on a minute, then they replaced them with private clinics like the Galway clinic, which were the same size. So the private clinics aren't too small, are they? Since 2007, the crisis has been exacerbated by an embargo on recruitment, meaning less staff have to do more work. And this embargo was facilitated by the leaders of the trade unions who pushed the Croke Park deal in 2010. But even during the Celtic Tiger years, back when Mary Harney was Minister for Health, they were still going for the same policies. And she was the one that brought in the outsourcing that led to the deaths in the cervical smear scandal. Those deaths are on Mary Harney's head, and on the heads of James Riley and subsequent health ministers like Simon Harris, who refused to reverse those policies. So privatisation policies and outsourcing policies were in place during the Celtic Tiger. But when the 2007-2008 crash came along, it gave them an excuse, as Naomi Klein pointed out, to accelerate the process of destroying the public health service. The nurses are right to strike, and Fine Gael are worried that the nurses' strike might encourage other workers to fight back and might encourage other workers to put forward pay claims. But in an economy where the median wage is 28,000 and 50% of workers earn less than that, where most working class people don't have a hope in hell of buying a house, where Fine Gael claim there's a recovery, but we're not seeing any of it. In that kind of economy, workers need to fight back, and every working class person needs to stand up and support the nurses. Their fight is our fight. It's the fight for a better health service. It's the fight for a world run in the interests of working class people and not in the interests of the profiteers.